Hello, Assalamu alaikum. In this video, we will be studying overview of blood supply of lower limb. In this video, we will discuss that from the beginning and to the end of the leg, what are the main arteries in the lower limb. First of all, we get the aorta, the abdominal aorta portion, which is going to bifurcate into common iliac artery and two common iliac arteries it gives off, which will supply both the lower limbs. Now, each common iliac artery divides into two, which is external iliac artery and the internal iliac artery. An internal iliac artery divides into two and gives off obturator artery and the inferior gluteal artery, which supply the posterior compartment of the gluteal region, which is the area of your butt. Now, external artery is going to cross this inguinal ligament. This oblique ligament is the inguinal ligament coming from the anterior iliac spine and over the pubic bone, and this is a ligament, and when it just crosses this ligament, it becomes femoral artery. So now this femoral artery will gives off some branches. As we know, there is no other branch going at the posterior of the hip, so this femoral artery is responsible to supply the posterior compartment as well. So it gives off profunda femoral artery, which is a big artery, and it also as well as supplying the deep structure of the anterior thigh. It also supplies the posterior of the thigh. So posterior of the thigh, there is no specific artery for the posterior portion of the thigh. The arteries coming in the anterior are just going to go through the muscles or go penetrating through the muscles and supply all the structures of the posterior as well. So the femoral artery gives off profunda femoris, which gives off some circumflex arteries, which we will study in a few seconds. And after that, femoral artery goes posterior to the adductor magnus, crossing adductor magnus, adductor hiatus. It goes to the posterior side, and after it crosses the adductor hiatus, it comes out. It is going to be known as popliteal artery, as it is entering the popliteal fossa. So it enters the popliteal fossa, where it supplies the knee joint, and it goes down, and there it bifurcates into two tibial arteries. One is going to be the posterior tibial artery, one is going to be the anterior tibial artery, and we have another artery which is the branch of popliteal artery. It is fibular or peroneal artery. Now the anterior tibial artery is going to cross the interosseous membrane of tibia and fibula and enter the anterior compartment of your leg, as considering that we are studying the leg portion, because this diagram is not much visual. So later on, it will supply the palmar side of the foot, forming medial plantar artery and lateral plantar artery. So this is the plantar surface, not the palmar surface. Palmar is in the hands. Sorry for my mistake. So over here, as I told you, anterior tibial artery is the branch of popliteal artery. Now let's come back to the anterior portion of the leg. Here we have anterior tibial artery, which goes down and then bifurcates into two perforating branch of fibular artery. It gives off some perforating branches, and it also gave off dorsalis pedis artery, which supplies the foot. This is the visual graphics which are taken from anatomy zone. These pictures are from that person, and he is the owner of these pictures. I am just explaining them So this is the abdominal aorta, which bifurcates into two common iliac artery, and those common iliac artery are bifurcating into external iliac artery and the internal iliac artery. After that, we can see the inguinal ligament through which the which artery has to cross the external iliac artery will cross and becomes the femoral artery. Okay, so then we have profunda femoris, which is a branch of femoral artery, and that profunda femoris gives two circumflex arteries, which are lateral circumflex and the medial circumflex artery, as you can see over here. After that, it becomes superficial femoral artery. Now this superficial at the back side, we can describe them into two names, or you can just call it as a one name as a whole femoral artery. But if you want to go more deeper, then you can say that the upper portion over here, which is not yet bifurcated, is the common femoral artery, but when they bifurcate into profunda femoris and normal femoris, then this is going to be the superficial femoral artery, and this is going to be the profunda femoris artery, which profunda means deep femoral artery. This deep femoral artery supplies the posterior as well as the adductor magnus and some deep structure of the anterior as well. Superficial femoral artery now goes through the adductor canal and adductor hiatus and enter the popliteal fossa, and as we know in the beginning, it was coming from the femoral triangle, which is at this level, uh, from the inguinal canal, as we from the inguinal ligament. As we know, the base of the femoral triangle is inguinal ligament. Now you can see the adductor hiatus. This is the muscle, biggest muscle of the thigh, and this is known as adductor magnus, and beside adductor magnus we have this big hole, and this big hole is known as adductor hiatus, and through this hole our femoral artery crosses over and enter the posterior leg. Now it has become the posterior. Now as it enters the popliteal fossa, it becomes popliteal artery. Now this popliteal artery runs through popliteus and the gastrocnemius muscle, and this is why it can be our peripheral heart of our body, because the muscles inside and outside are going to compress the arteries to increase the blood pressure during exercise. Popliteal artery gives off some genicular branches which supply the knee. Popliteal artery is now going to give off some branches, as I told you before in the overview or in the diagrammatic picture, that it gives off two branches which are anterior tibial and the posterior tibial, and then another branch from the between is going to be the fibular or peroneal artery, which stays close to the fibular bone, fibula. And the anterior tibial artery goes through the interosseous membrane of tibia and fibula and tibia, and then enter the anterior compartment of the leg. The anterior tibial artery lies down and forms the dorsalis pedis artery, which supply the superior surface of the foot, while the dorsalis pedis, lateral plantar artery and medial plantar artery are the three arteries of the leg, from which medial plantar artery and lateral plantar artery are the arteries which lie in the inferior surface of the foot or the plantar surface of the foot. Now these plantar surface have an arch formed by arteries, which is supposed to be formed by the anastomosis of dorsalis pedis and lateral plantar artery. Now this is the deep plantar arch. So this is the name, and this is the diagram. That this deep plantar arch is formed by dorsalis pedis and lateral plantar artery. And here we are again. You can have a look and study everything in this one diagram, that how all the main branches or arteries supply the lower limb. Now, as let me tell you, we have some anastomosis over the knee, we have some anastomosis in the hip, and we have a lot of anastomosis in your foot. These all anastomosis will be studied in detail in other videos, but for this video this is enough, and thank you so much for watching. Hope you like the video. If you like the video, give it a thumbs up, and if you do not like the video and you have any suggestion that will make our video better, you can comment it into the comment section below. Thank you so much for watching. Allah Hafiz.